Greetings, everyone. This is Jay from Monarch Housing Associates. Welcome to our training on the 2018 NJCounts point-in-time count. In New Jersey, our annual single night snapshot of who is experiencing homelessness in our communities. Just want to mention that if you can see down here, monarchhousing.org is the website. You can find any of the training materials, including this video, for your reference and for the reference of anyone else who may be interested in participating in NJCounts 2018. So this is just a brief overview of what we're going to go over today. You can also find a list of these topics in paper form in our data collection guide, which is one of those resources that we provide for your reference with regards to the point-in-time counts. This is the quick reference guide. This is a handy handout to give to volunteers and folks who are participating and doing the point in time, especially the paper survey, because it has some really useful definitions, some of which we'll be discussing here in this presentation. I also want to make sure that everyone has access to the formal HUD guidance with regard to the point-in-time count and data collection for the housing inventory chart, which is submitted along with the point-in-time count data to HUD. These are the resources with regard to PIT methodology and HIC and PIT data collection that may be of interest to you and your point-in-time coordinator. Make sure you take a look at it if you have any direct questions about what the standards are for methodology and implementing the count in your community. So again, what is the point-in-time count? When you're looking at a single night count of homeless persons in a given area. And so it's supposed to be as statistically reliable as possible, unduplicated, so you're not counting anybody twice, and inclusive of both unsheltered and sheltered homeless persons. It's conducted in the last week of January here in New Jersey, as well as across the country, because it's a HUD requirement that it be done in that time frame in order to secure and be in compliance with the continuum of care funding that's provided by HUD. And it's planned, coordinated, and carried out locally here in New Jersey. And if you have any questions on who to contact in your community with regard to coordination around the point-in-time count, you can reach out to us or to your local point-in-time coordinator. So why are we doing a point in time? Obviously, it's not just for a federal requirement. It's also because we're hoping to utilize the data for local homeless planning purposes. It's important to know who is experiencing homelessness and where, and understand some of the factors contributing to their experience of homelessness. What services or what types of interventions are needed by these folks in order to end their homelessness. So who do we count in the point-in-time count? These are three of the different kind of buckets that you might encounter folks or respondents which you're conducting the paper survey. There are three kind of categories here. Unsheltered, which would seem intuitive. That would be somewhere that someone is sleeping where it's not designed as a human habitation. So in an abandoned building, outside, in a bus or train station, etc. Those are folks that would be counted who would qualify as, quote, unsheltered homeless. Sheltered persons would be experiencing homelessness, but still in a place that's a safer place to stay, have a roof over their heads, such as an emergency shelter, a transitional housing location, which there are some transitional housing programs specifically for homeless persons in New Jersey, or folks who are staying, for instance, in a hotel or motel placement that's being paid for by an agency of local government or a charitable organization. So someone who is in a hotel or motel placement that's paid for instance, by the Board of Social Services locally. Now, this third category, at risk of homelessness, is basically anyone else. The reason that I say that is because these may be folks that we would consider or who would consider themselves to be experiencing a homeless or housing crisis. However, they do not meet the HUD definition, which is what we're looking for in this point-in-time count to make sure that we submit the accurate information of homeless. So if you're doubled up with another household or living in an illegal dwelling or an overcrowded place or in a hotel or motel that you are paying for as the respondent, that means that technically you do not count as homeless on the night of the point in time count. If you're at risk of eviction, if you stayed in a jail or prison, you know, or are being discharged from a healthcare facility and you've been there for a certain period of time, you're technically not considered homeless. So these are some important distinctions, and the next slide shows why. The reason that these are such important distinctions is because there's a different methodology for counting some of these folks who might be in different groups. For instance, sheltered programs, if I can jump to the second one on this list, there are some shelter programs in our state. Many of them are in HMIS, or the Homeless Management Information System. And as long as those programs are entering the data of who's in them on the night of the point in time count, there's no reason for a paper survey to have to be completed unless there's some sort of an addendum that communities want to incorporate to get additional information besides what's required for HUD. So that would be an example where the methodology is definitely very different for a shelter program that's in HMIS, because folks don't have to do a survey on the date of the point in time count. They just have to make sure that the data is up to date in the HMIS system. And as you can see here in the note also, all shelter programs, whether they're in HMIS or not in HMIS, will be required to submit a summary survey form. And we'll get to that in a moment. But let me just show you a quick shot of it. The shelter summary form looks like that. So if you're encountering someone or doing a street count and you encounter someone who is in an unsheltered location, those are folks who are not going to be in a sheltered program, and they will not have been entered in HMIS. Even if they have street outreach staff that are working with them and collecting some of their information, if they did not stay in a sheltered location on the night of the point in time count, they are not going to be able to have their information included for the count from HMIS. So we'll need to get a paper survey completed with anyone who's in an unsheltered location. Okay, the same thing applies for folks who might be at risk of homelessness. Let's say you encounter someone in your food pantry or during street outreach, and they tell you that they're staying doubled up with someone who is a relative or friend. Technically, that person doesn't meet the federal definition of homelessness under the HUD rules. However, they may be someone who is at risk of homelessness and is in a housing crisis, and there's no reason not to complete a paper survey with them. Now, they won't have their information in HMIS because, again, they did not stay in a program that is a shelter program that would be entering into that system. So in order to capture any information of someone who is at risk of eviction, doubled up, in a tenuous but still technically non-homeless housing situation, the only way to gather their information would be via paper survey. Okay, so once again, this is the shelter summary form. So any shelter provider, whether it's shelter, emergency shelter, a agency that has a hotel motel placement program, an agency with a transitional housing program for homeless persons, domestic violence shelters, anyone that's providing shelter to homeless persons on the night of the point in time count, we're requiring that they complete and submit this shelter summary form within 48 hours of the day of the point in time count and submit it to your point in time coordinator. Now, to explain why is very simple. If we have information in our data collection that shows that we have 25 surveys for 25 individuals from your agency, however, your individual records, your logbook, say, on the night of the point in time count shows that you have 24 people in your program, we know that there's a discrepancy, and we need to make sure that we address that, and we would reach out to you and to your point in time coordinator to make sure that we get the accurate information. So this information on the shelter summary form should be completed not from your HMIS information, but from your actual agency records outside of HMIS. And as you can see, you can enter the data for multiple programs, even on one page. So if you're a shelter that has a family shelter program, a men's shelter program, a women's shelter program, you can enter all of that information information on a single form, and you can get that form from your point-in-time count coordinator and submit it to them within 48 hours of the date of the point-in-time count, so we can make sure that all the information we collect is accurate. This is what the paper survey looks like for your reference in the presentation, and we'll be discussing it in detail moving forward. It has been reformatted, there have been some changes, so we'll go over all of that. Now, when is this year's point-in-time count for 2018? So we're going to be conducting surveys if you're doing overnight counts, you would be doing it in the overnight period between Tuesday, January 23rd and Wednesday, January 24th. Okay, that overnight period is the overnight period that we're trying to determine where people were staying that evening. If you're doing daytime counts, do those counts on January the 24th. Okay, because if you look at the survey and you look at question 1, it asks, where did you stay on the night of Tuesday, January 23rd? So we're trying to ask about the night prior if we're doing a daytime count. Overnight counts, obviously, if you're trying to do street outreach for folks who are in the middle of the night staying out in the street or in another unsheltered location, you would do that on the night of the 23rd that goes into the 24th. Some communities, just for your reference, you should make sure you're talking about it with your local point-in-time count coordinator and discussing it at the training. Some may have a 7-day service-based unsheltered count methodology. This would be where you would be able to conduct surveys not just on the 24th of January, but also in subsequent days if you encounter someone who didn't happen to access services on the day of the point-in-time count, but was homeless on the night of the 23rd. Make sure you discuss that option and whether that's your community's methodology with your local point-in-time coordinator. So just some general survey guidelines. Make sure that you're only conducting one survey per household, okay? A household is defined as any group of persons who would be housed together if they were able to obtain permanent housing. So I'm not doing a survey per person or necessarily per adult, but I'm doing a survey per household. I only need to conduct it with a single individual because the way that the survey is set up, if you look at question 6, allows me to gather information about all the members of the household just by speaking with one individual. To that end, whoever I'm talking to, I need to be talking to them and interviewing them, not handing them the survey for them to fill out individually. We're doing this point-in-time training in order to help everybody understand what the operational procedures are. And the reason is because there are some details here that we need you to know and get accurate information for, and a respondent wouldn't be able to do that and fill it out on their own accurately. You can see on this bullet about reading answer options. Make sure that when you're looking at the question that's being asked, that you only read all the answer options when it says to check all that apply, okay? If there's a question, for instance, in question 1 that says check 1 only, we are asking that you not read all of the answer options to the respondent. Instead, just ask them the question in bold text and then wait and interpret their answer as appropriate based on the answers that are provided. Okay? If no response is given by a respondent to any question on the survey, leave the answer blank. That will be whoever is entering this information into SurveyMonkey, which is our data collection tool for paper surveys. They will know if that question is left blank that there was no response, okay? Any other response, even if the answer is that there are no factors that apply to someone, like they don't receive any income or they don't have any disabling conditions, there's an option that says no, this does not apply. Make sure that you don't leave it blank if the answer is none apply or this doesn't apply. Only leave it blank if there's no response. Now, the exception to if there's no response, leave it blank is question 6, and you can see that that's the biggest question with the demographic information table. The reason for this is that if there's an answer that they're not willing or able to provide to you, and you're looking at them conducting this interview, for instance, with regard to age, gender, race, or ethnicity, we do ask that you provide information based on your observation of the respondent. Okay, if I'm looking at someone face to face, I will have a chance at getting that information pretty accurate. You know, age may be more difficult, you know, and sometimes race is a guess. However, we really need to have some of this information as accurate as possible and complete as possible. And if someone is not willing to give you that information directly, you know, we don't want to miss that opportunity while you're speaking with them to get their information in the survey. The exception to that would be if I'm interviewing someone who says that she and her son stayed in their car on the night of the point in time count, and I don't see her son, but I see her, I would only, and she's not willing to give me her age or her son's age or her gender and race or her son's gender and race, I would only fill in the information that I know about her, because she's the only one I can see, as I said before. I'm not going to guess based on who she is what the information would be for her child. So don't guess information about other household members for question 6. And if no response is given for question 1, don't complete the survey. The reason being is because we won't know if that person is homeless or not, and therefore we won't be able to utilize that information for reporting purposes. Okay, if you're a veteran program that you only serve veterans, please label all clients as veterans or having served in the armed forces. Same thing for domestic violence programs. If your survivor of domestic violence program or shelter is serving exclusively that group or subpopulation of persons, please make sure you label all of them as victims of domestic violence or survivors of domestic violence who are fleeing on the survey. If your program is in HMIS, paper surveys from your program won't be counted unless it identifies that a client stayed in a location other than your program or your shelter. And then during deduplication processes, what we do is we take, if there's an agency conducted paper survey over a duplicate from another location, let's say that you have someone in your shelter that doesn't enter into HMIS, and it's a code blue shelter, and you have a survey completed for John Doe who stayed in your program that night, but someone who did the street count the next day also completed a survey with John Doe, we would take the information from the survey completed by you, the shelter program. Okay, if there's let's say a HIMIS entering shelter, and that information is collected directly from the HMIS system, but that person who stayed in your shelter also got surveyed the next day in the street count, we would take the HMIS record over that paper survey. That's why it's so important that we have accurate HMIS information. Okay, HIMIS participating programs that are entering multiple services into the same program, however, will not be able to have their information pulled from HMIS for the point in time count. Let me give you an example. It would be a program that's paying for hotel motel stays for clients. However, they're also in that same program in HMIS entering information about clients that they're providing back rent payments for or utility payments to keep them from entering homelessness. So those folks that are receiving the assistance for prevention would not count as homeless, whereas the persons receiving hotel motel placements would be. So it would be a mix of both persons that should be counted and shouldn't be counted in the point in time count, and we wouldn't be able to use that HMIS program. Okay, some basic tips for conducting interviews are introduce yourself, try to connect person to person, ask if this person has already taken the survey is so important, because if they already have, this is one of our deduplicating mechanisms. We don't want to make people go through a survey more times than they are absolutely needed to do it. You can assure them that the answers are anonymous. We do collect, as you can see in question 6, some identifying information such as initials and age and gender, etc. However, those are only collected for the purpose of deduplication. We don't track that information. We don't provide any information about where people are or who they are to any party. It's strictly to make sure we don't count them twice. You can conduct the survey in a quiet, private way. Try not to ask compound or multiple questions at once. Try to give them the opportunity to respond and then clarify if necessary. And then ask the survey questions only as a guide or as an entree. If you need to, you can ask other questions to clarify if people aren't quite understanding or you perceive that they're not certain about what you mean. And be respectful, friendly, polite. Thank them for their time. This is not an easy conversation to have with someone. This is a very real life conversation that is difficult for someone who may be, even if they're not homeless, if you're interviewing someone at risk, someone who is feeling very vulnerable about their housing situation, and in general, you're asking some pretty personal questions about income, about who they are and their family, and what they're looking for and what their experience has been. So use this survey as a guide to getting the information that we're required to gather, but feel free to make it a conversation that takes on its own, interpersonal dynamic. Okay, survey site identification. We're onto the paper survey itself now. You can see at the very top, it's asking for code, county, agency, and program name. You can fill that in unless it's already been pre-populated. Some of your point-in-time coordinators in your community may have pre-populated that information for you, so you don't need to worry about it. But if you don't have a pre-populated top of your paper survey, make sure that you get that information from your point-in-time coordinator prior to filling out the paper survey, because we need to make sure we know the code for your agency. That's how we track any discrepancies with data that may be occurring once that survey has been submitted. Okay, for survey question 1, where did you spend the night of Tuesday, January 23rd, you can see in parentheses it says check 1 only, right? So that means I'm just going to ask the respondent that bold text and then wait for their response. And if they say, I was staying in my car, I know that that means I have to check the box next to this first answer: on the street, under a bridge, abandoned building, public building, or car, traveling on a bus, or camping out. So I'm waiting for their response and interpreting the answer, not reading all of these answer options. You can see over here that there's some definitions or some basic framework definitions of the answers here provided. That's because this is an example of some of the material that's on our quick reference guide. Want to make sure that if you are conducting the interview and someone tells you where they've stayed on the night of the point in time count, that you can clarify with them what that means and make sure that you categorize their answer as appropriately. Okay. So you can also see that in multiple of our answers, there's at the very bottom an other box. Let's say that you have someone that's staying somewhere that doesn't fit in any of these particular places that's listed here on this this answer option list. That means that you could check off other and write in the answer. However, what I would encourage everybody to do is please read this list of answers, check on the quick reference guide for what those answers really kind of pertain to prior to conducting these surveys, because more often than not, when people write in an answer, it's an answer that's already been provided on the list. So please help us out with that and make sure you understand, because it's going to help us get accurate information. Question 2, in what town did you spend the night? You can see we're asking for state, county, and town. And then you can also ask whether they've been staying in a particular program at a particular agency on the night of the point in time count. So if I'm conducting this paper survey, I want to know if you say you stayed in a shelter, I want to make sure I know which program that may have been, whether it's men's shelter and then the agency name ending homelessness group, if that's the example. And make sure you get the state, county, and town if possible. What this does for us is really helps us deduplicate and make sure that we don't count anybody twice if we know that they're staying in a particular program. And just so you remember, if you're at a Project Homeless Connect event, or if somebody's walking into the agency where you're a volunteer, that's not necessarily where they stayed that night, right? So just keep that in mind. Don't jump to a conclusion. Make sure you ask the question of that respondent. And if the respondent's not staying in a program, let's say that they say, I stayed in New Jersey, I stayed in Union County, I stayed in the town of Cranford, but I was in a hotel motel and it wasn't part of any program. I would not have to enter any information for program and agency name, so I would leave those blank. Okay, moving on to question 3, how long have you been in your current living situation? We're only asking the respondent about their most recent continuous living situation. So question 3 is basically asking the person, how long have you been at the housing location or living situation that you told me about in question 1, when you told me where did you stay on the night of the 23rd. So it's the most recent continuous living situation, and we're asking, as you can see, for the number of years, months, and days that they've spent there. So you can see another example here. If the respondent has been homeless when they're talking to you on and off for 2 years, but they most recently lost their housing 2 weeks ago and are staying in an emergency shelter, I would write 14 days as the length of time that they've been in their current living situation at that emergency shelter. Okay, if you're conducting this interview with someone who is in a shelter program or a transitional housing program, for instance, one that's not using HMIS or one that is a domestic violence program that can't use the homeless management information system, you can basically extrapolate that their length of stay in that situation, in that program, is going to correspond to how long they've been in their current living situation. However, if they came from another shelter prior, that may not be the case as well. So you do want to make sure that you drill down and get that information. Ask that person how long they've been in the situation that they told you about when they told you where they stayed on the night of the 23rd. Okay, and question 4, during the past 12 months, how many months have you been in any of these 3 locations: on the street, emergency shelter, or in a safe haven? Make sure that you enter the number of full months of homelessness the respondent has experienced during the past 12 months in this answer. Okay, if the respondent has never been in a homeless location in the past 12 months, enter zeros. So basically what we're asking here is, in the past 12 months, how many months have you been in any of these 3 living situations? So obviously, the total cannot be more than 12, okay? But let's say that it's someone who had spent about the last 8 months on the street, and then from the street went directly into an emergency shelter bed. Okay, that would mean that they would have 8 months on the street and 4 months in emergency shelter. The reason that this question is so critical, and the reason it's asked this way, is because it goes as part of the calculation of whether this person meets the definition of chronically homeless. Okay, if this person's total homelessness in the past 12 months in these 3 locations equals a total of 12 months, if they were homeless for all of the last 12 months, they might meet the definition of chronically homeless. So that's why it's so critical to get an accurate picture of how many months in the past 12 they've spent in any of these locations. And it may be that they stayed in emergency shelter for a month, and then on the streets for a month, and in a shelter for a month. So don't make them do the math. Help them out and say, okay, you stayed there for a month, you stayed here for a month. That means that if I'm getting this right, you stayed here in emergency shelter for 4 months and on the street for 8 months. Is that right? That's an example of something you might need to clarify. Okay. Question 5, how many separate times have you been homeless in the past 3 years? Since January 23, 2015. As you can see, this is also a really detail-oriented question about these 3 locations and how long people have spent in all 3 of them. The reason it's asked this way is, again, trying to make sure that we gather information about whether this person might meet the definition of chronically homeless, because if they have 4 episodes of homelessness in the past 3 years, that total 12 months, they may meet the definition of chronically homeless. So it's really important that you look at all of the information. Basically, what is the best way to get this information is to ask the person about their history of where they've been staying over the past 3 years. Maybe it starts out with, you told me in question 1 that you were staying in emergency shelter. Where were you staying before that? And how long were you there? And where were you staying before that? And how long were you there? And you'll be able to put together a picture of how many episodes of homelessness folks have been experiencing. Now, a really important piece, if you can get to this level of detail in the conversation, it's crucial to distinguish between episodes, okay? If I stayed in emergency shelter for the past 4 months, and prior to that, I had been unsheltered for 4 months. That is not 2 distinct episodes of homelessness if I came directly from the street into shelter. That's one continuous episode of being in an unsheltered and emergency shelter in any homeless location, okay? So what we need to distinguish between episodes, quote unquote, or times in experiencing homelessness is a period of non-homelessness that intervenes, okay? So if I, however, had been in emergency shelter for 4 months, but prior to that, I had crashed on the couch of my mother for about 2 weeks or 14 days. Then, prior to having been at my mother's, I had been on the street. Those would be 2 distinct episodes of homelessness, because that 14-day period was spent in a place that's not one of these 3 locations. It was in a non-homeless location, okay? Because technically I was housed with my mother for those 2 weeks, okay? And the standard is not 2 weeks, but it's 7 days in a non-homeless location, as you can see here. So make sure that you get to that, that conversation piece about, and understand prior to having the conversation about what distinguishes between 2 separate episodes of homelessness. And as you can see, there's space here for multiple episodes of homelessness. The real key is to record it as accurately as possible. And like I said, make sure that you know that just because that person stayed in 2 different locations, for instance, in one emergency shelter and then another, and then on the street, that doesn't mean it's a separate episode of homelessness, unless in between changing those locations, in between those multiple homeless locations, they had a period of at least 7 days when they were in a non-homeless location. Okay? For respondents that have had one continuous episode of multiple nights of homelessness, like I just mentioned, right? If they have been staying in emergency shelter for a month, and then in another emergency shelter for a month, and then in another emergency shelter for a month, that's still one continuous episode. So I would only need to complete row 1. Okay? You could have someone who's experienced multiple years of homelessness, but they've never stayed for more than 7 days anywhere other than an emergency shelter or on the street. That person would still have 1 episode of homelessness. It would just be very, very long. And so you would be putting the number of months here and the number of months here in emergency shelter and unsheltered locations, and it could be as high as 36 months, right? Because we're asking about the past 3 years. So just make sure you understand how to distinguish between episodes. If the respondent has never been in a homeless location in the past 3 years, let's say you're interviewing someone who's doubled up or at risk of eviction, you will not have to complete these with numbers. You can just put a 0 across row 1 because they've never had an episode of homelessness in the past 3 years, if that's their case. Okay. Okay, question 6 is the biggest, most important data gathering tool on this survey in some ways, because it gives us the information about all the household members. Okay, so we're asking that you complete it as completely as possible and accurately as possible for every household member that shared the identified sleeping arrangements. Okay, so that's a key phrase, because in question 1, you asked the respondent, where did you stay on the night of the 23rd? If they say emergency shelter, then, and they have another household member with them, say a child or a spouse or a parent or a multiple household members with them, but those members of the household didn't stay in that shelter with them that night, those other household members should not be included on this survey. Okay, so as you can see, the second bullet, if household members spent the night separately, do not include their information on this survey with the respondent. The reason being is that hopefully wherever those persons stayed, either they were in a non-homeless location and therefore shouldn't be included in our data, or they were in another homeless location and will be surveyed or have their information gathered at that location or by virtue of their affiliation there. Okay, so here's an example that comes up a lot. Let's say that there's a parent, a woman in a women's shelter or an individual shelter who is staying there on the night of the point in time count, but she has 2 children who stayed with her sister on that night. Now, those 2 children, even though they are part of that family with this mother, were not sharing the identified sleeping arrangements that this respondent had on the night of the point in time count. So technically that night, this mother was homeless in shelter, but her children were not homeless because they were staying with a family member on the night of the point in time count. So on her survey, we would only be entering information for her on row 1. Okay, and for the children, there would not be any information on this survey. Okay, if you encounter a respondent who's unsure about information, such as the mental health diagnosis or any of the disabling conditions of any of their household members, let's say you're speaking to an 18-year-old who is in a household with their grandparent and they don't know every piece of information about that grandparent, whether they're a veteran, whether they have a chronic health condition, etc. Just ask that respondent to give their best guess for the information, and whatever they provide, we can record as the most accurate information we could gather about the household members. This is your only chance at getting information about the household members is through this respondent. So just encourage them that, if you're not 100% sure about the information, give us your best guess at the information. Otherwise, they can always just not respond. But, we really want to try to get especially disabling condition information and some of these other pieces of information about the demographics so that we can make sure we're not, capturing duplicate information for a household. If the respondent gives no response for themselves with regard to age, gender, ethnicity, or race, as we mentioned before, you shouldn't guess this stuff about them for other household members, but do guess that information for the respondent. Okay, don't guess other things about them, such as necessarily, whether they've fleeing domestic violence or whether they've served in the military, but give your best answers based on observation, and ask them to give their best guess if they're uncertain about themselves. If the respondent gives no response for other household members, please, the very baseline thing to try to achieve would be the gender and age of each of the other household members. The reason being is that some of this data can't be accurately submitted if we don't know their gender and if we don't know whether they're a minor below the age of 18 or an adult. So that's why we need their age. Okay. So in the demographic information, breaking down question 6, you can see that the respondent is considered the head of their own household, even if they're not the adult the most senior member of the household, they can be considered the head of household for the purposes of this survey, and everyone else in the household will be defined as relative to them. And every member of the household's relationship can be provided here. On the quick reference guide, I encourage you to just take a look at the responses that are acceptable responses for relationship to head of household. For instance, we'll ask for sibling instead of sister, etc. And we're asking for the first initial, middle initial, and first two letters of the last name of the person, again, just to distinguish between records so that we don't have any duplications. The survey is anonymous. If they don't have a middle initial, you can leave that space blank. And that should be it. You will see on your survey that the word self is pre-populated on the paper survey. In most cases, row 1 should always be information for the respondent, okay, on the paper survey. Okay, moving on to the age, gender, ethnicity, and race section. For age, make sure you enter a valid number. For gender, enter one of the following options. This is one of the changes to the point-in-time survey this year based on HUD guidance. So the options would be female, male, transgender, or gender non-conforming. And you can see here, we also have an abbreviations guide. It would be good to just take a look at that because as you can see on the paper survey, there's not a great deal of space. And so you're probably going to need to use an abbreviation to designate gender. For race, you can see that there's space here for the initials, but pretty much not a full list of what their designated or identified races are. So again, consult the abbreviations guide and make sure you complete that. You can also see here that on this list we have someone who is identifying as both black and white. That's perfectly all right. They can identify as multiple races. Just record whatever racial identities that they choose to identify with, and we will make sure that there's an ability to enter that information for people who are multiracial in their background. If the respondent is Hispanic, please make sure that they understand that their ethnicity is distinct from their race in the eyes of the persons who have designed this survey information, okay? So the way that you could be designated if you're Hispanic, you could be black and Hispanic if you're from one of the Dominican islands. You could be Hispanic and Pacific Islander if you're from Filipino background. So there are different ways to answer it. The default position, if you're looking at the U.S. Census Bureau information, is that most people who are Hispanic are pretty much lumped in with Caucasian in race. But again, you could be Hispanic and identify as an indigenous person or a Native American. So make sure that these persons understand and explain that if they identify as Hispanic. It can be an awkward conversation, but it's also something that we just need to make sure people understand. It's for the purposes of this particular survey tool and the lens that the government looks at our backgrounds through. Okay. Again, if no respondent is given for any household member, please try to get at least gender and age for each. With regard to household characteristics, mental health issues, physical disability, developmental disability, as you can see, we do have some guidance on kind of some of the pieces that may define those. That's part of our quick reference guide. However, one of the things to consider is whether these are experienced and are expected to be of a reasonable duration. That's really what it would entail to be a disabling condition. So, and it would, inhibit the person's ability to live independently. So those are some of the characteristics that you could be looking at in terms of asking about if they have a disabling condition. Some of the others could be a chronic health condition, HIV/AIDS, and then we also have some definitions here right next to the disabling condition block, which obviously there's a row for each of the respondents' household members. Please make sure to note if any of those household members are actively fleeing domestic violence, or if they have served in the armed forces and are a veteran. Okay, so someone who is fleeing domestic violence, there has been some increased emphasis on this in the point-in-time count data collection by HUD. This is folks who are actively fleeing a family member or someone else who is being physically or psychologically abusive to them or violent toward them. So please try to drill down on that and make sure that they are actively fleeing, not that something happened years ago and their housing situation is not pertaining to that right now. Try to make sure that you have that conversation, painful as it may be, and brief, so that we're not causing someone to be reflecting on a very difficult period in their life more than is necessary. With regard to serving in the armed forces, one of the things that sometimes help is to make sure that people know they're not going to be turned away or unable to access services just because they are a veteran, and explain to them that it's really not a high threshold requirement to be counted as a veteran. It's really anyone who has been deployed at least one day of active duty in one of the U.S. Armed Forces. So please keep that definition in mind. If none apply, okay, so for instance, if you are asking an individual whether they have any disabling conditions, whether they're actively fleeing domestic violence, or whether they've served in the armed forces, and they say no to every single one of them, do not leave that row blank, okay? Really key is to put a check mark right here in the none apply box pertaining to their row, okay? Because as we said before, if any question is left blank on the survey, that's going to be interpreted as no response, okay? In order for it to be interpreted as none apply, really needs you to check off that box as none apply, okay? So in question 6, be sure to ask a direct question about each characteristic for each household member. So for instance, does any member in your household have a mental health issue? And have a substance abuse issue? Are any of the members veterans, etc.? And be sure to check none apply if none of these characteristics applies. Only leave them blank if no response is given for an individual household member. Okay. So question 7, finally to the back of the survey, where was your last permanent address before becoming homeless? Complete that with town, county, state, and country. And if no response is given, leave it blank. Question 8, what was your residence prior to your current living situation? You can see that this one says check one only. So I'm only going to read the bold question and not read all the answer options. And then I'm going to interpret that person's response and check off the box that is the most appropriate based on their answer. And you can also see that there's an other box if their answer is not listed. So you can check that off and write in the response that's appropriate. Okay. Question 9, what was the primary factor that contributed to or caused your current living situation? Please, again, it says check one only. Read only the bold question and do not read all the answer options. Check one only, and it'll be what you've interpreted from their response. And if, again, you have to, you can use the other box. Question 10, which of the following do you or anyone in your household receive? Check all that apply. So one thing that you can see here, this doesn't say check one only, it says check all that apply. So in that case, what we're going to do when we ask the question is actually read all of the answer options to the respondent. So I can ask, so which of the following do you or anyone in the household receive? Does anybody have SSI, SSDI, TANF, general assistance or welfare, unemployment, disability insurance, etc.? And the same thing for non-cash benefits. Food stamps, Medicaid, Medicare, anyone have any of these in the household? Make sure that you ask each of those options to help people remember what may qualify as a source of income or a non-cash benefit, okay? And you can see here, and I think we'll get to the other point later, but you can see here that there's some definitions available on your quick reference guide about what is SSI, what is SSDI, because those are different types of supplemental and Social Security disability insurance in, sources of income. TANF, which is temporary assistance for needy families, basically welfare for families in other terms. And then general assistance is a state welfare program for individuals. Social Security obviously is a source of income for seniors. And so just make sure that you take advantage of that quick reference guide and the definitions as you may need them, and fill it out as completely as you can for everybody in the household. Okay, so each household member, even if the respondent doesn't have SSI, but one of their other household members does, we're asking about anyone in the household receiving these types of income or benefits. And you can see that in addition here to the other category, let's say people have other sources of income not listed here, you can see that there are really important fields right at the bottom that I have a little arrow toward. No source of income or receiving no government benefits, okay? If the respondent says that their household receives no income, they have zero income, okay? Make sure that you don't leave it blank, because again, a blank question would mean no response. Instead, check off no source of income. And if they're receiving no benefits, such as food stamps or Medicaid or Medicare, make sure you don't just leave it blank. Check off receiving no government benefits, okay? Moving on to question 11. What is your total monthly household income? Make sure that you reiterate to the respondent that it's monthly and household income, so it's per month, and it's every member of the entire household who has income, okay? So not just the respondent, but anyone. If they have a partner, if they have other household members, even anyone who's in this survey included with them in question 6. Question 12, would you or anyone in your household like to receive any of the following services? And then check all that apply means I'm going to read each answer to the answer option to the respondent, and I can also obviously check other if there is any need to based on their responses. And this is the end of the paper survey. Make sure that you thank this respondent for their time. This is not just a simple thing, like we said before. It's a really important contribution that they're making to our local efforts to understand homelessness, and it's a really important thing and impact that they're having. Okay, completed surveys, make sure that everything's legible. Input and submit the information to the NJCounts 2018 online service tool. Survey tool, excuse me. There may be communities where you as an agency or as a volunteer are not required to enter this information directly. You may be just turning all of your completed surveys into your point-in-time coordinators for entry. So make sure you communicate with your point-in-time coordinator and that you're on the same page as they are with regard to where your surveys have to go when and who's inputting them into SurveyMonkey. Regardless of who's submitting them, make sure all your surveys get to your point-in-time coordinators, because if there's any discrepancies with the data, we're going to be following up and may need to refer back to the paper surveys. Okay. Now we are going to take some time to look at the 2018 online survey tool in SurveyMonkey. Okay, so this would be taking paper surveys and actually entering that data into the SurveyMonkey tool so that we have that information for the point-in-time count calculations. Okay, so the online service or survey link will be sent out to communities. The practice link is going to only be available through the 16th of January, and that is because shortly thereafter the live link will be available. So the live link for most folks will only need to be utilized from the 24th of January through Wednesday, February 7th. Okay, there's a 2-week window from the 24th of January through the February the 7th to enter all paper surveys into the SurveyMonkey tool. Okay, that's the deadline, February 7th. all must be calculated and entered into the SurveyMonkey tool by that time. Okay, if you have some programs like Board of Social Services who are paying for folks in a program where they know that that person or that household is going to be in that bed on the night of the point in time count, you can see in the fine print down here that that live link technically will be available as of January the 17th. Okay, but only certain programs will be able to enter their information prior to the day of the night of the point in time count. So please make sure that you're coordinating with Monarch or your point in time coordinator to ensure that you know when you're supposed to be entering surveys. For pretty much everybody, except for a handful of projects, it's going to be starting on January 24th and going 2 weeks. Okay, so again, do remember, if you're doing the 7-day count time frame, you may not need to enter all your surveys the first day after the point in time count. Just so everybody understands as well, you should be able to utilize the link that's sent from for the live survey tool via some mobile devices, if that's one of the ways that you're implementing your count locally. So please make sure that you're on the same page as your point in time coordinator about how you're completing the surveys. Again, February 7th, 5 p.m. is when the survey live link is going to be gone. So please make sure that between the 24th and the 7th of February that you complete that data entry in SurveyMonkey. Okay. All you have to do to input the data online is click the live link that's sent, and make sure, if you're able, that if you have more than one person entering data, that everybody is on the same page about what you're using in terms of any abbreviations you may be inputting. But really, it would be best if you could keep it to as few people, even maybe one person doing the data entry, so that they have a way they're doing it that's uniform. If a question requires an answer but the respondent did not respond or it was left blank, you can select no response, and that should be able to get you through the required questions. And if question 1 or the gender or age fields in question 6 are blank, you don't necessarily have to input this survey online. It's probably not going to be usable, but take that under advisement and use whatever survey methodology your point in time coordinator has prescribed for you on that. Okay, in terms of inputting the data here into the actual form, you can see that there are some questions that have a red asterisk next to them. Those mean they're required, and you can see down here that if you leave one blank and you try to move on by clicking the next button, it's going to yell at you and give you something like this that shows this question requires an answer. If you need to use the navigation and you missed something before, you can use the previous button to return to the page you just completed. Okay, so this is page 1 of the online survey. It's really just collecting the identifying information at the top of the survey. So make sure you enter the correct information using the codes that were given to you by your PIT coordinator. Next question, where did you spend the night of Tuesday, January 23rd? Question 1, select only one option. Okay, it's a checkbox. And if you need to check other, you can check the box or the circle here, but you'll also need to then click into the text box and type in whatever response is necessary. Okay. Question 2, the format is such that you're going to need to take a look at these list of options and check off the box next to whichever county this person said that they stayed in, this respondent who is completed the paper survey in front of you. Okay, you can see that if they said out of state, then you can check other state. But these are all the counties in New Jersey, and if it's left blank, then you can also select no response. But let's say that it was someone who stayed in Union County, because that's where Monarch is from, Union Counties. Okay, I would check Union County here, but don't forget that there's also in question 2 the option to enter the program name and the agency name. So if I need to do that, then I can't just click Union County and click next. I have to click Union County and then complete program name and agency name and then click next. Okay, so let's say I click next because I'm in Union County, And Monarch is in Cranford, so I click off the town of Cranford because, as you can see, let me just go back to the last page for you. Once I clicked Union County, what that did when I hit next is it brought me to a list of just Union County municipalities. Okay, so whatever the county is that I'm selecting here, I'm going to select that county, and it's going to take me to a list of the municipalities that are officially registered as part of that county. Okay, so then I can select the municipality that is appropriate, that's part of the answer, or if it's other, then I can check the box of other and specify in the text box. Okay, so that should be good for the question 2. You've recorded all those fields because on the county list you can see you have the program and agency name. Don't forget about that. So once I've selected the town and clicked next, I go to question 3. How long have you been in your current living situation? You can see years, months, and days. What you can do on these questions with the drop-down menus is I can click here typically and choose the first drop-down, and then I can use the tab button on my keyboard and the numbers on my keyboard and do what's called tabbing across so that I don't have to do everything as drop down here, drop down here, drop down here. But select the most accurate drop-down option. If the survey that you're looking at is blank, you can select no response. And please make sure that you simplify data entry by using all 3 units. So for instance, if the respondent said they've been homeless for 18 months, you can enter that as 1 year and 6 months. Okay? Question 4, during the last 12 months, enter the number of months of homelessness in the past 12 months for each of these. Again, if you do the first one, then enter the correct number based on what paper survey you're looking at. You can tab down or tab across to the next field and then just use your keyboard to enter the next number as appropriate. If the respondent has never been in the homeless situations, you can enter 0. If this survey is blank, or if there's no response, you can select no responses from the drop-down. Okay. Question 5, how many separate times have you been in homeless on the streets, in emergency shelter, or in a safe haven? As you can see, these are in drop-down format as well, so you can tab across. So just select the appropriate number of months that the respondent's household has experienced per episode by each location. If the respondent has never been in these locations in the past 3 years, you'll need to enter 0s for at least the first row, every single column, all 3 columns. And the reason is that otherwise it's not going to let you through because it has a little red required symbol next to it. Okay, if there's no response, select no response, and distinct episodes again should be separated by at least 7 days if you're conducting this survey directly in SurveyMonkey with someone. Okay, question 6, who was homeless with you? The demographics table. This information, again, is really helpful to use the tab across feature. You can select self for question 1 under relationship to head of household. Then you can use your keyboard for the initials and the first names and last names, and then the age you can enter on your keyboard. So make sure that you at least have all of the information in question 6 completed in row 1. Okay, if there's information missing, then there will be a no response option. Okay, be sure, again, as you can see, we've numbered these rows for you in SurveyMonkey just like it is on your survey. Make sure that the correct information matches the correct household member. Okay, you can see here an example of what it looks like in the drop down. Make sure that you select one of the valid answers for relationship to head of household prescribed. And then if the respondent is no middle initial, there is a none option. If no response is given for any of these fields, there's a no response option. And you can please make sure that, again, you complete the first row. For if it's an individual household, you have to complete that in order to move on. Okay, still in question 6, we have to have a separate section for the race question, and that's because you can select multiple races. Okay, so make sure that you fill this out appropriately with whatever racial identities apply to a household member. Check all that apply, and if that row is left blank for a household member, make sure you check no response. Okay. Question 6, with regard to household characteristics, again, check all that apply to each household member. number. You can see we've numbered the rows again for you to help you organize that and make sure that it's correct for each household member. Again, make sure that you are appropriately using the none apply row. Only if that row is blank should you check off no response. Okay. Make sure it's all completed in an accurate way for each household member. And again, you're going to have at least an answer for row 1 in order to move on to the next page once you hit next. So next is question 7. Where was your last permanent address? Make sure to enter all the information of the town, county, state, and country. If no answer was provided, you can leave it blank. Or if the respondent is not homeless, right, they've been in permanent housing forever, you can just enter NA in the town field. Question 8, what was your residence prior to your current living situation? Check one option. If no response is given, there is a no response option. Otherwise, you can type an other answer if that's not one of the listed options in the text box provided. Question 9, was the primary factor that contributed to or caused your current living situation? Check one option. If no response is there, check no response. Otherwise, you can use other. Question 10, check all the income or benefits options that apply to any household member. So as you can see here, just for your note, if you're looking at the paper survey, no source of income has migrated from down here to up here in SurveyMonkey just because of the formatting. Don't be fooled. Don't miss out on it. Make sure that you know that no source of income is down here on the paper survey. So if it is checked off on your paper survey, make sure you go up here and check it off as appropriate. We've also added in a no response option if that section is left blank in question 10. But otherwise, make sure you do know the receiving no government benefits or no source of income options are there, and check all that apply based on the household's answer. Question 11, what's your total monthly household income? Please enter a valid number. Do not enter commas or periods, please. Okay, even if it's more exact with a decimal and change, don't enter that, just enter a round number. And the number should reflect, obviously, again, all the household members. If there's no response, you can just leave it blank. On to question 12, would you or anyone in your household like to receive the services that follow? Check all that apply. There is also an other box or a no response option if it is left blank or if the answer is not listed. After finishing question 12, you can see that your entry is accurate and complete. You can click the done button. Okay, congratulations, you've made it. But just be aware that that means you won't be able to change the data anymore. And if you click the done button, you should see this screen. It should say, congratulations. Well, actually it says, thank you for participating in NJCounts 2018. I'm saying congratulations. If you want to complete another survey, as you can see down here, you can click the done button on this thank you screen. Okay, so clicking this button will take you right back to enter another point-in-time survey for NJCounts 2018. If there is a problem with the data you've entered and you realize it later, contact Monarch. Okay, that information will be part of this presentation. However, if you're done, if you've entered all your surveys, you just close the window out and you are done with NJCounts 2018 from the paper survey and SurveyMonkey perspective. Okay? Now moving on, the next section of this presentation is for those agencies that are participating in the point-in-time count who are utilizing HMIS. And it's really pertinent, not just for the point-in-time count, but for all times to gather accurate intake information. First off, please make sure that you get your point-in-time coordinator your shelter summary form, if you're a shelter program, no later than January 26th. Okay, so that's 2 days after the count. And they are going to pass that information along to Monarch because, as you can see, it's just collecting basic program information, but it includes HIMIS program name. And what we're going to do is we're going to pull that information for the point-in-time count from the HMIS and then check it against what we have, on your shelter summary form to make sure it's accurate. Okay, when is the point in time count? It's the 23rd into the 24th of January. So please make sure that that information that you enter into HMIS is entered timely and accurately, because we are going to do our first pull of the information 2 days after the point in time count. So get your shelter summary form in and get that data updated within 48 hours. That is our HMIS standard, at least for the statewide collaborative, so it shouldn't be too difficult to accomplish, hopefully. The verification and finalization of this HIMA data from the poll that we do for the point in time count is going to be completed over the course of the next few weeks by Wednesday, February 7th. What we're going to do is take the HIMAS information, take the shelter summary forms, match them up. If there's any discrepancies or if there's duplication in some way, we are going to contact you and make sure that you get your HMIS data up to date before we do our final poll on the 7th of February. Okay, ensure it's accurate for that date, especially for the 23rd and the 24th of January, both individual information and household level info, and update the income to reflect the current information. Don't change the original admission information, just conduct an update. You can contact your HMIS provider if you're experiencing difficulties. I know not everybody is in the HMIS collaborative, so if your provider is not HMFA, then contact either Coming Home or Bergen County. Okay, every question should have an answer. There shouldn't be any missing fields or unknown or data not collected unless it's really what the client presented as information. However, if you have someone who came into your shelter a week ago and you see for the point in time count that some of their information is missing, re-interview them if possible, and get that information, kind of try to drill down so that it is complete for the point in time count. And be careful when entering birth dates and income data. We have had point in time counts where we had some accidentally wealthy homeless persons walking around, and that's just because someone entered a extra zero or so in the monthly income data. So we just want to get that accurate so that it's reported correctly. And with birth dates, it's really important to not confuse birth dates with admission dates, because if you're an individual shelter and you confuse someone's birthday with the day that they were admitted, they could wind up looking like a 0-year-old person. So please take a look at that and make sure that's accurate. And ensure all the household members are gathered appropriately. So just so you're aware, when you're entering an HMIS record, what we're taking from that HMIS record to create a unique identifier for deduplication are these fields: name, age, which is derived from birth date, gender, race, ethnicity, and all the members of the household. So basically, if there's a household of 4 with very similar initials, very similar ages, very similar race and ethnicity, that's one we're going to flag as a possible duplicate if there's a paper survey that has that same household. Okay, so these are some really crucial pieces that we're going to be utilizing for that deduplication. Disabling condition information is one of the really critical elements for gathering point in time count data, but also in general in HMIS, okay? And you'll see in the next few slides that really what we're focusing in on is making sure that the information gathered at the point of entry into an HMIS program is going to give us an accurate picture of whether or not the person who's in the program might be chronically homeless. Okay, that's one of the really crucial things. So disabling conditions and other subpopulations, make sure that the disability definition is not just something where you're asking someone whether they have a diagnosis. That's not what we're looking for, where they don't necessarily have to have SSI or a Med 1 or a letter from a doctor in hand. We're really just looking to ascertain if that condition is of a long-term duration and the person would benefit from supportive housing, okay? If that's the case, then you can answer yes in HMIS to the person having a disabling condition, and you can see also next to it in the HMIS intake form that it will ask you if this is expected to be of long-term duration and impede the person's ability to live independently. You should answer yes if that's the case. Not whether or not they have the diagnosis, but on the basis of whether or not that condition is going to be of a long-term duration and is going to hinder their ability to live independently. So they might need supports in order to maintain their housing. Okay, so update the information if it has changed since the initial interview. We said that earlier. Okay, parts of the disability question in terms of identifying the disability, it is self-report or the knowledge that you have of the client. You know, again, this is what I had just mentioned before in anticipation of this slide. Does this person need or would they benefit from supportive housing? If yes, make sure you check the box indicating that it's expected to be of long-term and indefinite duration and substantially impair ability to live independently. Just so you know, if you're someone who's entering in HMIS data, if you don't check that box, that it's expected to be of long continued and indefinite duration and substantially impaired ability to live independently, there's no way that this person is going to be chronically homeless. Okay, that's just the way the definition works in terms of the HMIS system. So it does have a very important implication, because if someone has a disability, but it's not going to be something that is inhibiting them for the long term, they cannot be qualified as chronically homeless, which is, again, one of the important criteria we're looking to count and consider in the point in time. Okay, other subpopulations that are important in HMIS: veteran status. Have you ever served in the armed forces? This question isn't concerned with the technical definition of veteran. There's no time requirement for service in order to qualify, and assure clients that they won't be prevented from receiving services if they answer yes. One of the other things to really be keeping an eye on in terms of updating information as appropriate: if you have a family program and you have 17-year-olds in your project that have turned 18 since their initial intake interview, that means they became an adult, and while at their initial intake at 17, they did not have to be determined as a veteran or a non-veteran, that question will now have appeared for them, and you'll need to make sure that you complete it so it's not missing for that 18-year-old. Okay. Victims of domestic violence, we're usually asking to capture those who are currently fleeing. So please make sure that you complete that information in HMIS about domestic violence history accurately. There's no specific time frame requirements. It doesn't have to be that they just left today from their abuser. However, the information is going to be pulled from the question, are you currently fleeing? Okay, so this field shouldn't contain data not collected or refused or the client doesn't know, unless that's really the case. Don't forget to ask that question, because it is going to be key for our reporting on that subpopulation. Okay, homeless history, approximate date homelessness started. Again, why are we asking this question? We're really trying to drill down on whether or not they might be chronically homeless, because the chronic homeless numbers really impact our own perception of whether we're ending homelessness for those persons who need help the most and who have had the longest term homelessness or homeless experience, and whether they're actually able to access the permanent housing opportunities we have. And in the case of the community perception by HUD, it's really something that HUD focuses on when they're looking at whether or not our community is effectively ending homelessness. For local planning purposes, it serves as an indicator about whether or not we're actually targeting resources successfully, or whether we need to refocus our energies because it's an issue that's impacting our progress, right? Maybe our system is just serving people who are easy to serve or easy to access or are able to advocate for themselves, but it may not necessarily be able to reach out to and engage and serve persons who have been homeless the longest. Okay, it's this question about approximate date homelessness started. What's it asking? It's asking when did their current episode of homelessness begin, and it's asking how long this person has been homeless in other locations prior to coming to you for assistance. So basically, what you're looking for is the information pertaining to whether the person has stayed, or excuse me, how long that person has stayed in this current episode of homelessness. Okay, so let's define homeless. the person that stayed on the street in an emergency shelter, transitional housing program, or a safe haven. But what the question's not asking is when was the last time they had a lease and paid rent, how long they'd been couch surfing, how long they've been in a substandard housing situation, or how long they have felt homeless. It's really asking about the date when they most recently stopped being in a permanent housing location, somewhere that's not a homeless location. When did they enter into a homeless location? Okay, be clear about what you mean by homeless. Okay, so we're not just asking when did your homelessness start, right? We're asking how long have you been on the streets, in another shelter, transitional housing program, or safe haven before coming here today. Okay, and you can probe further when they provide the date, and you can say, so since that date you gave me, have there been any times that you've stayed with family or friends in a rooming house, boarding home, apartment you paid for, or had a hotel room that you paid for longer than 7 days? Because that's going to be relevant in determining whether that episode actually was interrupted, and that's not the most recent time that they had started being homeless. If they answer yes, you can follow up with when was the last time you stayed in one of those places, and approximately what date did you leave from that last stay, say in an apartment you paid for or a hotel that you paid for, and then that date when they left that location and went to one of those homeless locations like a shelter, transitional housing program, or the streets, that date will be their approximate date homelessness started. Okay, use the most recent date they provide as the approximate date after your further probing and your questions to follow up. The number of times the client has been on the streets, in emergency shelter, or in safe haven in the past 3 years, including today. That field, we shouldn't be asking how many times they've been homeless, because again, that may mean different things to different people, but do ask detailed, succinct, and probing questions that help you get to an accurate answer. So, for instance, in the last 3 years, how many times have you been on the street? In the last 3 years, how many times have you been in an emergency shelter? And in the last 3 years, how many times have you been in a safe haven program? So that's going to help you really drill down and not just ask a question with the subjective word of homeless in it. Okay? For total number of months homeless on the street, again, don't ask how many months have you been homeless in the last 3 years, but do ask stuff that's connected to the previous response. You know, have that conversation with the person. You said you were homeless in the street 3 times, in an emergency shelter 2 times in the last 3 years. The first time you were on the street, how many months were you there? What about the second time? What about the third time? And you can pretty much ask that person, you know, point by point or episode by episode, how many months they were in those locations, and piece together the total number of months they've been homeless in the past 3 years. Do the calculation for the total number of months homeless for the client yourself, and don't expect them to do the mental math there, and reaffirm the information you have from them. So as I understand it, you were in a shelter 2 times, 2 months for the first day, etc. Because that would mean, you know, in total, you've got a total of homelessness in 8 months in the last 3 years. Does that sound about right to you? And just make sure, you know, try to verify with them that you're getting this information accurately and you're paying attention to what story they're narrating about where they've been staying. It's also going to be able to give you the opportunity to get the most accurate information. With regard to income and benefits, be sure to identify each source and the amount associated with that source for monthly income. And for clients who have been in your program for a while, make sure you update that information, because obviously that's subject to change. For non-cash benefits and health insurance coverage, be sure to identify each source and update the records after they've been in your program for a while. For instance, people who are experiencing homelessness in a shelter may get linked to the Board of Social Services and get SNAP benefits or Medicaid while they're there and being engaged. And ensure the benefits make sense for the household. For instance, a single adult shouldn't have state health insurance program or TANF. And if a person says they receive a VA pension but didn't identify as having served in the military, that's not going to make any sense. Cause of homelessness and last address. For homeless cause, you can probe a bit to get as close to the root cause as possible. For instance, say they are explaining to you that their cause of homelessness was eviction. You can follow up and say, why did they get evicted? And if they're willing to disclose it. And if they say it was because they went to jail, you know, under cause of homelessness, you could say release from prison or jail rather than just eviction, because one really caused the other. Okay. For last permanent address, the zip code, please be sure it's the zip code for the town they identify and not for the program where you work, where they've come from. So just make sure that you're not just default entering what you know as the zip code locally. City, town of last permanent address, make sure that's complete. And then the county of last permanent address, ensure that you don't just put the county they're in currently, but indicate where they came from. If they don't know, it's pretty easy to look it up for them. Okay, some important dates for you HIMSS entering agencies. We're asking that you confirm your HIMSS program list with your point-in-time coordinator. If anything has changed since December, make sure you get that information to us as soon as possible. Submit the shelter summary forms again to your point-in-time coordinator within 48 hours of the point-in-time count, so by January 26, 2018, because that's when Monarch is going to be doing our initial data pull. We'll be doing our initial data cleanup pretty much immediately following the point-in-time count, starting on the 26th, but we'll be back and forth with you and your point-in-time coordinators if we find any discrepancies until February 6, 2018, because we'll be pulling the final data on February 7th. Okay, if you're unsure about how to update your information and you're part of the NJHMIS collaborative, you can use NJHMFA search to access some videos, tutorials, etc. You can call them, you know, or you can always, in the awards system, you can use the help desk feature if you have a problem. So use those resources. If you have questions, you can contact your local point-in-time coordinator, or like this video, we are having some webinars, and there are other trainings in other communities should you need to link someone to those trainings. Okay, all of the resources that I alluded to, the quick reference guide, the abbreviations guide, the survey itself, all those resources are available at monarchhousing.org. If you have a question pertinent to those materials, to this presentation, or to anything affiliated with the point-in-time count that we can help you with regard to survey materials, please make sure you email NJCounts@monarchhousing.org. It doesn't go to no one, it goes directly to my inbox, and I'll get back to you. My number directly is 908-272-5363, extension 232. Once again, my name is Jay from Monarch, and thank you for joining us for NJ Counts 2018. Please be safe out there. Stay warm, and we hope that you're able to connect with folks and hopefully collect valuable information that'll help our planning efforts and help these folks connect to services in the meantime, so they can get the help that they need and get the housing that they deserve. All right, thank you so much, and thank you for participating in NJ Counts 2018.